The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
Well, hi, this is Ken Auerback from Cartier, Bernstein, Auerback, and Steinberg. If you or someone you care for has been injured from no fault of their own, please contact Cartier, Bernstein, Auerback, and Steinberg at myinjuryli.com or call 631-654-4900. Whether auto or work-related, slip and fall, trip and fall, construction accidents, dog bite, medical malpractice, or nursing home neglect, or various other types of negligence, please contact me at Cartier, Bernstein, Auerback, and Steinberg by visiting me at myinjuryli.com or call 631-654-4900. I will represent you with integrity and passion. Living in pain from no fault of your own can be emotionally and physically detrimental and affect all aspects of your life. Please contact me, Ken Auerback, at Cartier, Bernstein, Auerback, and Steinberg by visiting myinjuryli.com or call 631-654-4900 for an immediate and free consultation and the support and representation you deserve. Well, hi everyone. This is personal injury attorney Ken Auerback from Cartier, Bernstein, Auerback, and Steinberg. Welcome back to our program for No Fault of Your Own. I'm here with my great associate, Amanda Spinner, and of course my co-host. Amanda, how are you?
Good. How are you?
I'm doing great, Amanda.
It's a little rainy.
Yeah, it is.
A little cold.
It is. And they're actually in the studio, off of the studio, they're actually going to be doing some type of movie or something, and now they got this wood stanchion blocking one of the windows. Right?
Yes, we're essentially in a cave today, so.
Okay, so, but we are happy to be here anyhow.
Very happy.
Okay. It's our goal, as you know, folks, to give you an insider's view of bringing and proceeding with various types of personal injury actions caused by the negligence of some other party. And among these areas that we will explore and we have explored are car accidents, trip and slip and falls, construction accidents, medical malpractice, dog bites, nursing home neglect, products liability, and really many, many other circumstances of negligence and the serious injuries that often occur. And through our journey together, hopefully we can remove and have removed some of the mystery, the uncertainty, and help you feel empowered, knowledgeable, and confident in the process. We are live today, so if you have a question, you can call the studio at 631-451-1039. It would be our privilege to answer any questions you may have about personal injury. And if you do call in, Amanda's got some news for you.
You will get a From No Fault of Your Own t-shirt.
We got to reorder them, I'm telling you.
They're very low right now. The numbers are low.
They are. But if you call in, we'll be sure to get you one. So today on the show, we're going to have a great guest, and we'll have him on shortly, Dr. Tom O'Brien. He's an osteopath. You may have heard him on this radio station, and he's someone that really we're looking forward to getting him on here, finding out about his practice, what he could do to try to make you feel better, and just find a little bit about his background. So we'll get to him in one moment. Before we get to that, Amanda, let's go back to something that I think is really critical, and I know we've reemphasized this and emphasized it, the issue about people calling us very soon after they have an accident, and the reason for that. And why is that?
So it's really important, like really within a few days of you having an accident, that you do contact us or an attorney, because we obviously specialize in this area and we know the process and what it takes. A lot of people are not familiar with no fault, which is critical when you first get into an accident.
A car accident.
A car accident, yes. But also just in general, getting to the right doctors, making sure that you treat, making sure that you're getting better. It's everything. We'll be doing the other stuff so you can kind of concentrate on getting better.
And one of the things that you've heard me talk about on the show, Amanda, and you know, it's something that actually gets my blood boiling, is when I get clients, they call me up. I had a lady last week again. And what she said was that she was being hounded by the insurance company for the other vehicle. Mm-hmm. And clearly the other vehicle was at fault for the property damage, but she was being hounded for them to come see her and talk to her not only about her property damage, but about her bodily injuries also. And they were trying to get her essentially to sign off on her bodily injuries before she really knew the full extent of them.
Right.
And if she did sign off, if you do sign off on a release and sign a release, that is going to be binding on you, whether you had a lawyer or didn't have a lawyer. Now, we've talked about it on the show that we'd like to see there be legislation, or at least in the insurance regulations, that preclude any insurance company from settling a bodily injury part of the claim without a person, let's say within the first 6 months, having a lawyer look over those documents.
Right.
But right now the law isn't that way. So they could literally come to you and they do it. I mean, last week, I think I had one or two people, same exact thing. Clear liability against the defendant for property damage. They call the person up. They keep on calling and they keep on calling. They keep on calling and they say, well, we'll settle your property damage for maybe the car had $15,000 of damage. And by the way, your bodily injuries, we'll give you a check for $1,000. And I'm not saying that if a person isn't hurt, that $1,000 might be good, right? But the reality is how do they know?
Exactly. And we've talked about it on the show before that oftentimes when you first come to us, we don't know the extent of your injuries. It takes oftentimes several months of treating in order to figure out what your true injuries are and the extent of them, and sometimes even longer than that. So, signing away your rights right then and there isn't going to be beneficial to you.
Pick the phone up and call us, because the one phone call that you could have with us can make the difference of you being compensated for. It could be a life-changing event in your life. It could be a situation where you're going to suffer with this problem for a long time. We hope not. You could be having this problem forever. The insurance company doesn't come back later and say, by the way, you signed off on the release, but we can really tell that you're hurt now a month later, 2 months, 10 months later. So we're going to take that back and we're going to now give you the money that you should have gotten.
Right. There is no real justice.
Yeah, so no going back. And so we don't want you to put yourself in that position. We feel strongly about that. And it happens all the time. Carriers know which ones they are. A lot of them are doing it. There's a few in particular. I'm not going to mention names. If they're listening, they know. They know who they are. And to go out there and do it for people that are essentially oftentimes defenseless at that point. I've had people with head injuries, literally head injuries, and the adjusters for the insurance companies are knocking at the door to get this person to sign off. And one young man did that not too long ago, and he was devastated when I told him what he had done had real big repercussions, and they were going to be binding on him. Another lady last week, same thing, but it's now getting very common, and it used to be one or two carriers. I'm seeing it with a lot more of the carriers now.
Right.
So if you're in an accident, any kind of accident, whether it's a car accident or another kind of, call us. Okay, we'll take the time with you. We'll go through it. If you say to us on the phone, by the way, I'm absolutely 100% fine. I have no injuries. I'm not going to treat. And the insurance company wants to go ahead and give you a check. We're not going to tell you to come in. We're not looking for a piece of that check. We want to make sure, though, if you are seriously hurt, that you're not waiving your rights. And these rights are important, and we want to make sure you're protected from the beginning. With regard to no fault, you have to file a no fault application within 30 days. Otherwise, your medical benefits are not going to get paid.
Right.
And that's not a form that most people are aware of, and you don't know the process. You don't understand it. So give us a call. You pick up the phone. We promise you that if there's something that we can do for you, we're going to be there for you. If it turns out, again, you're not hurt, okay, that's fine. We at least had a conversation. We got to know you a little bit, and you get to know us, and you can pick up the phone and call us in the future, or help with, or get some help with some other issues. But don't put yourself behind the eight ball. Just don't do that. They're not there to protect you. I can promise you. I wish I could say something different, but that's just reality. So before we take the break today, what I want to do is I want to bring on the show Dr. Tom O'Brien. Dr. O'Brien, welcome to the show. You're an osteopath, am I correct?
That's correct, yes.
So it's really good to have you on the show. I know that you actually have your own show, I believe, during the week.
That's correct.
Okay, on this station.
Yes.
What time is that?
It's Wednesdays, 4 p.m.
Wednesdays at 4 p.m. And Dr. O'Brien and I just recently got to know each other, and I really was very interested in his practice because I think his practice is very, very diverse. And I also think that it's really helpful. I know you just opened an office, I believe, in Patchogue. Am I correct?
East Patchogue. Yeah.
Okay, in East Patchogue. I don't believe, as far as I know, and I've been here a long time in this area, that there are any osteopaths in this immediate area. Am I correct, or is other osteopaths you're familiar with?
There are. I know there's a few that specialize, but not as a family practitioner. Someone who specializes in no fault.
Okay. So before we take the break, tell me what an osteopath is. What do they do?
Sure. We're medical doctors, and I will give you a description of, make it simple. So I am an allopath and a chiropractic combined. And so I can prescribe medications, do minor surgery, as well as I manipulate. And I went to medical school, as well as I did a residency in family medicine. So I specialize in family medicine.
Well, you know what? I think it's interesting when a person goes to an osteopath, because the bottom line is you sort of have a wide-ranging ability. Mm-hmm. And I really find that sometimes those are really the best type of doctors, oftentimes to screen out a person and then treat that person, but also figure out, are there other type of disciplines that I need to bring into this? And so we'll get to that on the other side. Thank you so much for being here.
Thank you.
Well, welcome back, everybody. If you're just joining us, this is personal injury attorney Ken Auerback with my great co-host here, Amanda Spinner, and also my associate. And you're on our program From No Fault to Your Own. We are live today, and we're exploring the most important issues in personal injuries caused by accidents. If you call into the studio right now, it's 631-451-1039. I would love to talk to you about any issues or questions you may have about personal injury, and you will also get one of our great From No Fault to Your Own t-shirts. And if you or someone you care about has been injured as a direct result of someone else's negligence, please contact us at myinjuryli.com or call 631-654-4900. That's myinjuryli.com, or call 631-654-4900. It really would be our privilege to fight to get you justice. And all of our consultations on personal injuries cases are always free. It doesn't cost you anything. And if we are retained, it's all on a contingency. It doesn't cost you anything unless we do make a recovery. We will also lay out expenses that you will not be obligated to pay us back unless we make a recovery. And Amanda, tell the audience when they can listen to our program.
So please listen to us every Monday from 4 to 5 p.m. And if you want to hear some of our older shows, please visit our website, myinjuryli.com, and click on radio shows. And we have a whole bunch that everyone can catch up on, and many different topics.
So we are back with our great guest today, Dr. Tom O'Brien. And Dr. Tom O'Brien is an osteopath, and he just was starting to tell us a little bit about what an osteopath does, and then the commercial interrupted us, Dr. Tom. So if you can please kind of pick up on that.
Sure.
Let's go there, and then we'll tell the audience a little bit about how you kind of got to that place.
Sure. Well, an osteopath is a medical physician. We went to medical school. We went to specifically an osteopathic medical school. We are considered the only complete physician, and what that means is I can prescribe medications, I can perform minor surgery, and I manipulate.
And when you say you manipulate, you're talking about spinal adjustments, or what are you talking about?
Yes.
Okay.
The founding father of chiropractic, Daniel Palmer, studied under Dr. A.T. Still, who's the founder of osteopathic medicine. So we call it a manipulation. They called it adjusting, to separate and make a distinct difference between us.
So why don't you tell us, too, a little bit about yourself. Mm-hmm. How did you become and decide to become an osteopath?
Well, first, I grew up on Long Island, specifically Freeport, Long Island, and I was an athlete growing up, varsity sports, and so I was very familiar with injuries. I was very fortunate that I didn't sustain major injuries, but you still do. And so I was like, okay, I'm too short to be a professional baseball player, so science came really easy to me, so I said, well, let's go into medicine. Well, what discipline? So originally I was going to school, I was at Nassau in the pre-chiropractic program, and in 1986, that's when I had an epiphany where it's like, I felt that chiropractic was very narrow. The scope of practice was narrow, and that's when I discovered osteopathy. My father was assistant president of NASA, and my grandma was vice president of NASA. And I was in his office, and I said, Dad, too bad. He goes, you finally came to that. I said, what do you mean? He picks up this phone. He calls someone at NYCOM, which is New York College of Osteopathic Medicine. He said, I want you to see this person tomorrow at this time. So I said, okay. I went over there, and that's when I said, this is me. This fits my personality. It gave me a broad spectrum of how I can practice. It fit my personality.
Got it. So with regard to what you do and when you do it, I assume you do and treat patients that come to you for what kinds of problems, and how did these problems happen?
Right. We'll start off with just family medicine, because I did my residency in family medicine. So from womb to tomb, I trained, I delivered babies, and my oldest patient is 96 years old. So hypertension, diabetes, asthma. I trained at St. Barnabas in the Bronx, which is the unhealthiest borough in New York City and one of the unhealthiest communities in the nation. So I saw everything. So that's my bread and butter. So whatever walks through the door, I basically can treat because I did a residency. I really don't have to refer to a specialist, a GP. A lot of people say, oh, you're a GP. I said, no, I'm not a GP. GPs did not specialize. They did not do a residency. I specialize in family medicine. I also rotated with all the specialists, therefore I can treat. The only time I refer to a specialist if I'm at a third or fourth line medication, and I'll say, well, I must be missing something, so therefore let's get a specialist on board. I'm also treat no-fault patients. So I take on individuals who are involved in motor vehicle accidents. And as in your opening, you made a very, very important point that it is necessary that you get medical attention and seek at least a consultation with a no-fault attorney, not just an attorney that specializes in no-fault, because there is differences in each discipline, just like in medicine.
It's funny that you say that, because I've been doing this a lot of years, and one of the things that just frustrates me more than anything is that people oftentimes, they don't put themselves first. So what happens is when I say about that is, life is busy and life has a lot of obligations on you, and they're hurt, they're injured, something doesn't feel right, they're in a car accident, and they're like, yeah, but I know I should treat, but, okay, and there's 15 other people that have needs or needs that this person needs to meet, and I'm like, listen, that's fine, you'll get a chance to meet those needs, but put yourself first.
Right.
And unfortunately, they don't do that. And then what I wind up with is I have a person who comes to me. Maybe they haven't treated now for the first month. And what the insurance companies will do when I try to get that person compensated, Amanda, what do they do then?
Deny it right away that, this person didn't treat for anything. They don't really have any severe injuries.
Right. And they delay treatment. So how hurt could they be?
Right.
Well, they delay treatment. They didn't go to the doctor. And the person says, well, but I delayed treatment because I had this going on or that going on. Sometimes they delay treatment because they don't know they could treat. Mm-hmm. And that's why, on the beginning of the show, we talked about pick the phone up and call us.
That's right.
All right. And this way we can direct you. We can direct you and say, this is what you have to do with your no-fault. Get on the phone. Call the insurance company. Get a no-fault claim number. The other thing that a lot of people don't realize, with private medical insurance, there's oftentimes co-pays and deductibles. That's not the case with no-fault. Right. And so a person could go ahead. It doesn't matter whether you're in a good financial position or bad financial position. No-fault was put into play so that it equalizes everybody, okay? Whether you're a person with a lot of money or little money, we're all in the same spot. And if you're hurt and you think you're hurt, get the medical treatment. Go in there and get treated. Don't sit back, do nothing, because either you don't know to do it, or you're being lazy, or you're not putting yourself first, or you simply just didn't get to it. And be in a situation where now you really are hurt, you're seriously hurt, and it could impact everything in your life. It can impact your working. It can impact your basic enjoyment in life. And now down the line, we're trying to go ahead and fight for you to get your money, and the insurance companies are fighting us. And they will fight us, okay? They use all of the defenses they could come up with. It's congenital. It's degenerative. The person didn't treat right away. The dog ate my homework. All of these things. And it can be very, very frustrating for you, but make it less frustrating. Put yourself in a position to get better. And that's what I tell people. Don't go to the doctor simply because, I could have a lawsuit. That's not the reason to go to a doctor first. The reason to go there is to get better. Okay? The reason to go there is to focus on your health. But certainly if you are hurt and you have some limitations, you have the right to be fairly and justly compensated. And that's why we want you to pick up the phone and call us. A doctor like Dr. O'Brien, who does do no-fault cases, he's going to understand how to bill the insurance company. Dr. O'Brien, if a person comes to you under no fault, that person doesn't have to submit that medical bill themselves, right? That'd be something your office would do for them?
That's correct. Yes.
Okay, and that's critical too because, again, why be overwhelmed with the situation? I've had people that they can use no fault. They don't realize it. They use a private medical insurance, and now that could be a lien. In other words, if you make a recovery later, they could be entitled to get that back versus no fault. There is no lien. They're not entitled to get that money back. You're entitled to have your medical treatment, and you're entitled to go to someone like Dr. O'Brien and get better and get evaluated. When we get back, we're going to talk about the details of that and how Dr. O'Brien evaluates you and what he's looking for and what he wants to do and how he helps you to get better. So we will see you after the break. So good to be with you here today. Well, hi, this is Ken Auerback from Cartier, Bernstein, Auerbach, and Steinberg. If you or someone you care for has been injured from no fault of their own, please contact Cartier, Bernstein, Auerbach, and Steinberg at myinjuryli.com or call 631-654-4900. Whether auto or work-related, slip and fall, trip and fall, construction accidents, dog bite, medical malpractice, or nursing home neglect, or various other types of negligence, please contact me at Cartier, Bernstein, Auerbach, and Steinberg by visiting me at myinjuryli.com or call 631-654-4900. I will represent you with integrity and passion. Living in pain from no fault of your own can be emotionally and physically detrimental and affect all aspects of your life. Please contact me, Ken Auerback, at Cartier, Bernstein, Auerbach, and Steinberg by visiting myinjuryli.com or call 631-654-4900 for an immediate and free consultation and the support and representation you deserve. Well, hi, everyone. This is personal injury attorney Ken Auerback with my great associate and co-host Amanda Spinner. And you're on our program, From No Fault of Your Own. We are live where we are exploring the most important issues in personal injuries caused by accidents. You can call into the studio right now at 631-451-1039. If you have any questions about personal injury, we'd love to have the privilege to try to answer them. And if you or someone you care about has been injured as a direct result of someone else's negligence, please do contact us at myinjuryli.com or call 631-654-4900. That's myinjuryli.com or call 631-654-4900. It would be our privilege to fight to get you justice. All of our consultations are always free for personal injury cases, and if you do retain us, you do not pay us a dime unless we are successful, and it's all on a contingency. If we have to lay out expenses, which we will, we'll lay those out too, and if we are not successful in your case, you don't pay us those back either. Listen to our program every Monday from 4 to 5 p.m. as we do explore these issues. So we're coming back on the show, but before we do that, Amanda, we really got to give a shout out to the great people behind the glass today. What do you think?
Yes. Shout out today to Anthony Barone.
Okay.
And Anthony David Levenstein.
Yes. It's so great to see them behind there. And smiling faces back there. But really, folks, we wouldn't be successful on this show without them really doing what they do behind the scenes and really helping us get the information out there and always working with us. So we're really grateful for them and happy to have the opportunity to work with them. So let's get back to Dr. Tom O'Brien.
Yes.
Dr. O'Brien, so as an osteopath, you said that you treat people and you can treat people who have suffered from car accidents.
That's
or in
right.
car accidents. What types of problems have you treated people with that have suffered from car accidents?
Yes, well, I treated all sorts of injuries, musculoskeletal injuries. Also, I will go over psychological issues. I'm not a psychiatrist, but it's still within my scope of practice. Coping. I think one issue we were talking about on break is when you're involved in a car accident. There's so much going on that a lot of the noises, just the stress, the adrenaline rush. Let us take that stress and off you, and let us handle it. Okay, we're here for you. We have the training, so I go over and we can go over coping mechanisms, but musculoskeletal issues, neck pain, lower back pain, depending on what walks through the door, I'm able to do a thorough history and physical and determine if they need to continue with a specialist, and then I will refer.
So what we found, and we've had people on the show that talk about it too, is there are situations where they leave the scene, they go to the hospital, and the hospital says to them, oh, there's nothing serious. And meaning typically there's nothing broken maybe, or maybe something didn't show in an x-ray, or maybe not right away because, right, you can have an x-ray that can be normal at the hospital, but with swelling, right, it's not going to show an actual fracture line, correct?
That's correct. It could take up to a week before you see a fracture on an x-ray.
See, that's very interesting. And I tell people that simply because you go to the hospital, if you're in pain and you're not feeling right, you need to follow it up. You need to go see a medical doctor. Now, with a practice like your own, would I be correct in saying that a person who's in an accident, who's in a car accident, and let's say they can't explain what exactly is going on with the body part, but let's say they're having pain in their back or their neck, or maybe pain even in a leg or an extremity, or just aren't feeling right, or maybe they're a little dizzy, and they could come to someone like yourself, Doc, right? And you could either treat them, or you'd be able to potentially send them if they had to go to other specialties too. Am I correct?
That's correct. Also, we're trained in knowing to look for those small neurological changes. I'm a ringside physician who amateurs and pros. So my responsibility is to look for those subtle changes, not the obvious. Anyone can pick up the obvious. Also, the ERs are not trained in, looking for those subtle changes. Especially they do for cardiac, heart attacks, MIs, myocardial infarction, and maybe for strokes. But when it comes for motor vehicle accidents, you really need to have that training. And we're looking for those subtle changes.
Yeah, I think that's really important, Amanda. Right? We've had some doctors on our show too have sort of emphasized that part. And we've had neurologists on here, orthopedics on here, and they've indicated that it oftentimes isn't so clear, and it's not clear at the beginning. What I'm interested about your practice, Dr. O'Brien, and I really think that you're going to fulfill a need in the community, is that people can go to you, okay, and you can really assess them sort of as a whole, okay, and I know a lot of times they'll go to an urgent care facility, all right, and the problem with that, and there's some good ones, but the problem with that is that they're oftentimes not focused on traumatic injuries. It's just not, at least my experience, they're not as focused on that. And so a person who went to a hospital or didn't go to a hospital, they could go to someone like you, an osteopath, and you could be evaluating their soft tissue and also their musculo and their skeletal issues. And it sort of makes it easier than now having to jump around between several doctors to finally get to the place where you kind of figure out what that is. Now, it may be that you think, I need to send this person out for testing, and then ultimately they really need to see a different discipline because it's not in your specialty. But it seems to me, and correct me if I'm wrong, that your practice, your type of practice, and your discipline is such that it's a great screening tool, even if you can't treat them for a particular problem, that you have enough training that you could see the problem at least.
Right, exactly. If we always say if you don't know the diagnosis or you don't know the term, describe it. Okay, describe it, then you have an idea. What system is it? And then you know what system to refer to. You were talking about urgent care centers. Most of these urgent care centers are run by PAs and nurse practitioners. They're not trained. They are not trained. They do not have the training I have as a physician. You know, that comprehensive background, residency trained. Not to say that not all PAs and nurse practitioners don't have training. They're not going to have the training I have.
But they might have training, but there's still something oftentimes my clients would like to at least see the doctor a couple of times and at least let the doctor go ahead and sort of keep a watch on the treatment because they feel like if they don't get that they're not getting potentially the best opportunity to get better. And I do think people, if they're going to a medical facility, they should have the ability at least to see the doctor and get screened. And in your practice, they are not going to be subjected to that, right? Where they're going to go to a PA and never see you.
No. There's no PH. You're dealing with the owner. The owner is me, the physician. So you're dealing with the physician. A lot of patients feel that the physicians are not, one, listening to them. And then if the patient's only seeing a PA, the physician isn't listening to them. So we have the same belief where we'll, look, listen, and feel. We look at the patient and your client, we listen to what they're saying, and then we feel them both physically and emotionally. And that's what I do in my practice. I examine my patients. I touch my patients. I don't sit at a table and type notes. I examine my patients, and I do exams, and my patients are like, wow, my doctor's never done that. Well, this is a real exam. This is the proper way. This is what I've learned almost 30 years ago, a thorough physical exam. I still do it now. This is, I started medical school 32 years ago. So I've been seeing and treating patients for 30 years, 3 decades.
And you actually, I know I've seen a report of yours. You actually really do take a long and time and an amount of time that's necessary to assess range of motion and whether the person has limitation or significant limitation. And the bottom line is that there are some medical practices, many of them out there, that they don't take the time to do that. And it's not helping the patient. It's not really assessing that patient properly so they know what's going on. But in addition, when we have to substantiate a case as being serious, one of the things that's looked at is this range of motion as to whether you have a limitation and what's normal and what that is. And you do that, right? And I've seen you do that.
Yes.
Okay. See, that's critical, Amanda, because when they don't do that, the patient is not getting the best treatment, but they're also not having the best opportunity to be successful in their case. So,
Right.
Listen, we're going to be taking a break again, and we're going to be back with Dr. Tom O'Brien. It's really great to have you here, Dr. O'Brien, and teaching us about osteopathic medicine and how to make people get better. We'll see you on the other side. Well, welcome back to our program. This is personal injury attorney Ken Auerback. If you're just joining us and you're up on our program from No Fault of Your Own, we are live and we're exploring the most important issues in personal injuries caused by accidents. If you or someone you care about has been injured as a direct result of someone else's negligence, please contact us at myinjuryli.com or call 631-654-4900. It would be our privilege to fight to get you justice. That's myinjuryli.com or call 631-654-4900. All of our personal injury consultations are free, and if you retain us, it doesn't cost you a dime unless we are successful. It's all on a contingency. We'll add expenses too. You won't owe us those either unless we are successful. And please listen to our program every Monday from 4 to 5 p.m. as we explore these issues. We are back in our program with Dr. Tom O'Brien, an osteopath who treats people for all different types of medical conditions. He's a family doctor, but he's also a doctor that can treat your musculoskeletal conditions as an osteopath. He's also done minor surgeries over course of time. What kind of minor surgeries?
Yeah, I did not, enter a surgical residency, but as if you see on my license, it says physician and surgeon. So I can do minor surgery where if you come in, I can remove, if you cut yourself, I can sew you back together. I can be a first or second cyst on a major surgery. If I can remove moles, stuff like that, minor surgical procedures.
Oh, well, I have a couple of, no, we can't do that now.
I got some skin tags I need removed.
Well, I have to say this. I'm looking at you, right? And you're on the show here for, let's see, 3 segments now. And I'm looking here, and all of a sudden I look at you, and I'm behind the mic, and I see Robin Williams. You're Robin Williams. Your face is exactly like Robin Williams.
That's it.
Let's give the listeners a visual.
There you go.
It was great.
What do you say? Wibble, wibble. You know.
Yeah, well, but also, right? And so I'm behind a mic, so I'm thinking, good morning, MacArthur Airport.
There you go.
Okay. So we're really glad to have you back here, Doc. And, some of the things that I think are really critical, and I know you've talked about, Doc, is that as a doctor, okay, you treat each patient individually. And
Yes.
you take the time and you screen that patient. Is that something that you find is important in your practice?
Absolutely. It's not a cookie cutter approach. We're all the same, but we're different. And you need to approach every individual. It's mind, body, spirit, mind, body, soul. So I have to cater my approach based on the individual's needs. And then we work together as a team, and as a team, we're successful. It's not an individual's separate, because we know that we have a professional team in New York City that it's a group of individuals, and until they work as a team, they're not going to win the cup. It's just not going to work. So
That's
the same
true.
thing in medicine. We need to work as a team. We work together. Well, what's the starting point? What's the end point? And together we develop a program.
And, what's really good, too, is I think, in your case, I know you have 2 daughters who are in their 20s. I always find that doctors who have been parents, they are able to work also with young people, because sometimes, it's different, right? If you've never had your own children, you kind of don't know how to approach them. It doesn't mean all doctors. There's some doctors, great doctors, that may not have children. But I do think it sometimes makes a difference when I'm sitting with a client, literally in my office. And sometimes, I'm sitting there and I'm thinking, this really could be my child. And I tell the parent, I'll tell them, I will treat your child just like I'd be treating my own child.
Absolutely.
And do everything that I can possibly do to get your child justice. My intention is, I had a young lady in the other day, and she was in a pretty good car accident, and she's got banged around, and she has a head injury, no question in my mind. And it's very upsetting. So for a young person, 20 years old, and you're just trying to kind of get through the day, and she can't understand why she doesn't feel right. And she looks at herself, and she's looking in the mirror, and everything looks the same, but she doesn't feel the same.
Right.
And, I think a lot of times what we have to do is we have to just look at that human being and give them, just the knowledge that it's going to be okay, and the knowledge that what you're going through, you're really going through. You're not imagining it.
Right.
Okay. If it was up to you, you'd rather have been somewhere else when the accident actually happened. And so I think that's important in the practice of medicine. I think it's important in the practice of obviously representing a client, but particularly in the practice of medicine, because you have people who really are scared. They may never have suffered something before. And what I like about, being able to have someone like yourself who can treat the patient, you can treat them early on, and you're able to go ahead and give them direction. And I would assume that's what you do, that if there's something that you can be helping them with, or part of what you could be helping them with, then you're on that. But I assume that you'd send the patient out if you believe they need some kind of testing, right?
That's correct, yes. To get to your point so we can really drive this home, my patients are family. I'm practicing a long time, so I treat each patient like they're my family. I had a patient who listens to my show, and he might be listening now, had an issue, and literally I walked him to the specialist, which is only a few doors down, and I sat through the appointment with him, and he could not believe that. Literally, I helped him make that appointment, and I sat in, and I spoke with the specialist, and we are our patient and clients advocates. We work for you. We do not work for the insurance companies.
See, I love that. See, I love that, and it makes a difference. It definitely makes a difference when you have somebody who's willing to step up for you, and a person who really does care. I have clients that I've been having as clients for many years, and when they come back, oftentimes they'll talk to me about things that are almost unrelated to their case. And they remember when maybe I took the extra few minutes and sat there and listened to them. Because, what happens is these are life experiences that people may never have expected. And what happens is it's almost a shock to your emotional system. All right? You're living a normal life, whatever your life is, and you have the things you normally do. And one day you have this trauma, and it literally upsets everything. And I think what you said earlier is that's the time for you to place your burden onto us. And whether it's Dr. O'Brien handling and making you, helping you get better, and at the same time, we handling your legal aspects. I always tell you, don't focus on the legal aspects. We have that. Nothing for you to focus on that. You go get better. You go treat with fine practitioners like Dr. O'Brien and people like himself who care about you, because it makes a difference. Because I've seen people that have gone to doctors, and the doctor does not treat them individually, doesn't treat them as a person, doesn't listen to them. And what happens then is they don't listen to them, and then there's a problem that may either get worse or never get dealt with. So really, you need to go to someone like Dr. O'Brien who'd be listening. So while we're at the end of the show here, could you tell us a little bit also, because I know that you've been involved in some charitable work, and I really like our listeners to hear that, because I do believe when you're judging to go to somebody that you kind of look at their whole character.
That's correct.
So could you tell me a little bit about that?
Yeah, sure. I have my own not-for-profit, my wife and I, and we're part of the board. Actually, my father is part of the board as well. But we help raise money so we can help those families that are in financial distress. We raise money. I was in a program beginning of summer where we helped raise $50,000 so 10 patients can have heart surgery. 10 individuals, financial distress. I do community outreaches, blood pressure drives, food drives, clothes drives. So this is what I'm about, really giving back to the community. I made a promise. I made a promise to God if I made it through medical school, made it through residency, that I'd give back. And I've been giving back for over 25 years. And I stepped up to have my own not-for-profit. I piggybacked off other individuals. My wife says it's time for you to get your own not-for-profit, and that's what we did. But this is an extension of my parents.
What is it called, your not-for-profit?
Yeah, my not-for-profit is Health Education Learning Programs, and it's help-10.com, and that's where you can learn more about me.
And if people want to get in touch with you and treat with you, what's the best way for them to do that?
Yes, you can go to my website, drtomio.com. That's drtomio.com. Or you can call my office at 631-980-8200.
Give them that number one more time, please.
Yes, 631-980-8200.
That's Dr. Tom O'Brien. I can tell you that he really is a person that does care about people, and he's a person that wants to get you better. And he's a person that's going to be necessary for you to get better, so that you can go on with your life, and we hope get 100% better, and also be able to document if you are seriously hurt. So please go see him, call him, and really we're so grateful that he came on the show here. Love to have you back some other time.
All right. I want to thank you for inviting me on your show.
See you next week, folks.
See you next week.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.